Hi, everyone. Welcome to week 2 of the 4-part webinar series on the Practice Comeback Plan. We've got a good number of people who are still joining. We expect a really big crowd today, which is great, but we're going to give those folks just a few more moments to join and get settled in, and we'll start very shortly. Thank you. All right, we've got a lot to get to, so we're going to go ahead and get started, even while people are still joining. So thank you for being here. Thank you for carving out your time again. If this is week 2 for you, and if this is week 1 for you in the webinar series, welcome. Glad to have you. I know many of you registered just a couple of days ago, and we had some additional availability, so we're glad to have you as well. I'm Justin Everett. I'm the Vice President of Marketing at Solution Reach, and I'll be the moderator or MC for today. And then we've also got Addison Reed, who's the Customer Education Manager, and just a beautiful beard. Hopefully, you don't get to really enjoy that on a webinar, but hopefully his personality will make up for that. I think you'll really love hearing from him and getting his perspective. And then we've got Hillary Melander also. She's a Senior Product Marketing Manager. She's relatively new to Solution Reach, but has just great content, great presentation prepared for you guys today, specific to telehealth and that part of our phase 1 practice comeback plan recommendations. So before we get too far into it, and I turn the mic over to those guys after a little intro, I want to cover a couple of housekeeping items. Again, this is being recorded, and we'll plan to send you both a recording of the webinar along with the slides that are being used today. And the slides are important as a PDF because you're going to see a lot of things on your screen that appear to be clickable, and it's an illusion. In GoToWebinar, you can't actually click on, but when we send the PDF of the slides out, you will be able to click out and get knowledge-based articles for how to do things in the Solution Reach platform, some things that Addison and Hillary will cover, but also some additional resources that we've included that are beyond the Solution Reach platform that I think will be really useful for you too. So be on the lookout for that, and we'll plan to share that. If you have questions, that's great. We've got a lot of content to get to today, so we won't be able to have an open Q&A like that, but we always encourage you to ask questions and let us know what you're thinking and how else we can help. So a few ways you can do that. One is you're welcome to put those in the Q&A tool in GoToWebinar. Worst case, we'll have a log of those questions and can try to get back in touch with you after the event as quick as we can. You can also, if you have support-related questions, you can visit community.solutionreach.com and click on my support tab there and search the full knowledge base to figure out how to make some tweaks and adjustments on your own. Or you can email community@solutionreach.com if you have a question, and we're happy to route that to the appropriate person and try to get you some help as quickly as we can. So with that said, for today, here's just a quick look at what we're going to cover. So if you were with us last week, we talked about phase 1 of our 3-phase practice comeback plan. And phase 1 was covering the things that we consider to be urgent. These are the things you need to be doing now. And hopefully a lot of these things you've already been doing. But there are 3 that got the most questions last week during the webinar, but then afterwards as well. And those were two-way texting, newsletters, and that's specific newsletters in the Solution Reach platform sense, and how to communicate at scale with your patients, when and why, and then also telehealth. So as we go into today, these are the 3 big recommendations. Again, I won't read through this full list, but if this should look somewhat familiar to you from last week, or if you weren't able to attend live, you got to review some of the resources already. But again, it's just 3 we'll cover today: two-way text, communicating more frequently with your your patients via newsletters, and then also how to implement telehealth. And you'll you'll see as we go through it that two-way texting and newsletters are just critical to making that really operational and work within, from a workflow standpoint, not just telehealth tools, but how you can use them to your advantage and make it really work for you, which is important, and we're all learning right now. So, before I turn it over to Addison to talk about how you actually go implement and can use two-way texting, one of the questions we got last week was around patient demand for this. So it's one thing to have the technology there, and we can build all the technology in the world, but does anyone want it? Does anyone want to use this stuff? And what we found at Solution Reach is, this is where patients are. So 4 in 5 patients own a smartphone. Text messaging, probably no surprise here, is the far and away the most used app on phones. 97% of us use text messaging, and we're using it a lot more than we talk on the phone, and a lot more than we listen to our voicemails. And sometimes I'm kind of ashamed to say that, but I'd much rather people just text me a lot these days. I know I personally don't answer the phone if I don't recognize the phone number, and I'm really bad about just having a backlog of voicemails sitting on my phone. So if we're trying to communicate with patients in a timely manner and make sure that they're getting our messages, voicemail not a great option for that when we can text as well. And I'll show you some of the numbers behind texting with providers. And 76% of patients believe that texts are actually more convenient than phone calls, and even prefer text and emails to phone. So I say that, and a natural question, and we got this last week from several of you as well, is, well, yeah, that's great, but does that work across generations? And so for me personally, I'm right on that line between being a millennial and a Gen Xer, and depending on how those years and time frames seem to move around, I can fall in either one. It's probably not a surprise that that's something that's good for me. 94% of millennials say they would like to receive text messages from their providers. Almost equally high numbers among Gen Xers. But boomers, I highlighted here in the dark gray, not because the number's lower. It's highlighted here because the number is as high as it is. So, 2/3 of boomers say, yeah, I'm open to receiving text messages from my providers. And this is the result. This is a piece of a study that we did of 2,000 patients, and we called it the patient-provider relationship study. Asked a bunch of other questions, but this I really wanted to highlight for you guys to say, yeah, people are accepting to get messages from their providers. But the two-way texting also, and it's TWO, but there's the TO piece of this as well too. Can I send, and do I want to send messages to my providers, where I can ask questions instead of having to pick up the phone and call or email? Can I just text in a question and try to get a response? And people are open to that as well across generations. So again, you expect the really high numbers with younger generations, but even among older generations, more than half say, yeah, this is something I want to be able to do. And on an overall level, 3 out of 4 patients say they're open to texting their providers. So I just wanted to give you some of that background, and we'll let Addison jump in here and tell you how it works, how you can do it through Solution Reach and make it really work for your practice.
Awesome, Justin. Thanks so much for that great introduction, and again, helping re-emphasize the fact that so many patients out there, they want to be communicated with via text. So what we're seeing here, this is what our SR Conversations tool looks like. On the left is what the view looks like for you as you view all of these incoming communications in the desktop dashboard. And then on the right, this is what it looks like for the patient. They're communicating with you directly from their phone. And of course, this works for any device that has the ability to text. They're able to make use of this service with their provider. So one of the questions that is very common that we also receive when it comes to two-way texting are, what are some of the best practices? So with that, if you offer this service, you need to let your patients know about it. You have to get the message out, right? Use everything you can to convey this message to your patients. Pull every lever that's available to you. So whether that means hanging up physical signs at the practice, reminding patients that they can text instead of call. Maybe you're updating your social media or your website pages. You might send an email blast out. You might even update the voicemail on your incoming phone message so that it reminds patients who are still continuing to call that they can text instead of call if they'd like. You can also just initiate these communications first. You can send these messages out to your patients and let them know that they can text now, which is a really convenient way to do that. Another thing to keep in mind is when you're using two-way texting services, and I know Hillary will get into this in a little bit, but you need to make sure that you are gaining HIPAA consent where applicable and when applicable. So with that in mind, we've actually created some templates here, and this is what we're seeing on this right-hand side. You can come into this SR Conversations tool and select one of the HIPAA consent messages and send that right off to the patient. They can reply with the word consent, and this little HIPAA consent icon will appear, will appear next to their name in Conversations. So you get a visual indicator that you've already gained consent from them via text. Now, you don't have to just use these system templates. You can create your own and customize them to fit the needs of your patients and your practice. I don't know about many of you, but I sure remember a lot of commonly asked questions that we would get all the time from patients, and we would get those in the form of a phone call. So you're still going to get those in the form of a text message, but if you come in here and take some time to create some of these custom templates that maybe cover things like what your office hours are or your office location if it's a new patient you're conversing with, this will really help save time for your staff. Now, it may seem like a bit of a no-brainer, but it's really important to always make sure that you're responding to these incoming text messages from your patients. This is especially true if it's a brand new patient that is communicating with your practice for the very first time, right? They may be, this may be the first time they're trying to text a provider, so having you respond back to them helps reassure that individual that they are communicating with the right person, that their message has actually reached the designated target. And along with text, it's very similar in some degrees to talking with your patients on the phone. You need to be personable, but you also need to be professional. And one of the other common questions we get is, hey, I'm seeing this little emoji option here in SR Conversations. Should we be sending those to our patients? And we recommend, if your patients are sending them, you may want to match that level of communication with them to make them feel more comfortable about using text to continue to speak with their provider. We leave that up to you. You know your patients so well.
Hey, Addison, thank you for that. I wanted to jump in and mention real quick because I know a lot of you are joining a little later. A lot of these links here, the gain HIPAA consent, use template messaging, these things you see here, you can't click on them on your screen, but when you get these slides afterwards, we're planning to send a recording and the slides, you'll be able to click on these and get out to some of these instructions and knowledge-based articles on how to do some of these things, like Addison mentioned. So another thing I'd like to have Addison shed some light on is on newsletters and newsletter communication. That's the second thing that we got a lot of questions about last week. And I want to set that up by just sharing the staggering numbers of newsletter and group message communications that Solution Reach sent to patients that first real COVID heavy week in the US, that week of March 16th, about a month ago now, which is amazing. We sent about 63 million messages to your patients on behalf of hopefully some of you guys and other customers of Solution Reach. So it's been really, while we're talking about two-way texting as this opportunity to provide one-to-one communication, let patients text you and you can text back with a very personal, immediate response. There's also a need to be able to send mass communications at scale that maybe can go quicker than you'd be able to do trying to pick up the phone and call everyone or handle it some other way. So want to make sure we spend some time on that with you guys today and talk about how to do that, how you leverage newsletters, make the most of them and get them built and out in the Solution Reach platform, but then also how you create them and what some best practices are there. So Addison, if you take it away, that'd be great.
Absolutely. Yeah, newsletters can be an incredibly powerful tool. Justin, you actually mentioned this on a previous webinar that we did, I think it was yesterday, where the text side is a lot more of that one-to-one communication with your patients. And the newsletters, this is an opportunity for you to have that one-to-many communication. So on here, and you'll be able to click these, like Justin said, once we send these out, but these first two bullet points are actually short training videos that show you how to kind of get started with newsletters if this is something that's brand new to you. Some of you may be sending a newsletter for the very first time, or you may not have even sent it yet. This is a fantastic time to get acquainted with this feature. It is free in our platform, so we highly recommend that you leverage it and use it. This is a fantastic time to try it out. But along with that, we have some articles here that talk about designing a newsletter from scratch. If that's what you want to do, that's totally fine. You can come in here and do that. Or if you're like me and you don't feel like you have a lot of great skills in design, you can come in and actually use some existing templates that we've created for you. And we have a whole host of them. On this next slide, we actually have just a small snapshot of a few that we've designed specifically around what we're all experiencing right now with COVID-19. So here you'll see some examples of ones with specific messaging around that. Maybe your office has already sent this one about being temporarily closed or offering limited office hours. We've even got one in there that you can send out to patients as you return to being open as you were pre-COVID. But you can come in here and just click that little edit button underneath one of the templates, dive in, change the applicable wording, and send it off. And it's so quick and easy to do. On this next screen, we actually have examples of what those newsletters look like on the patient's side as they receive them. And so we've got one, again, here's another plug for the COVID-19 ones, as well as telehealth, which we're definitely going to get into. I know Hillary is really excited to dive into that. But another question that's really common that we get around newsletters is, well, what are some of the best practices? Especially if you're doing this for the very first time, or if you're pretty comfortable with sending out newsletters, but you may want to just realign with some of the best industry practices. We've compiled those here. So first and foremost, you want to determine why you're sending the newsletter out. What purpose does that have, right? After that, is there something that you want your patients to do in response to that message? Do you want them to simply read and consume the material you sent them? Do you want them to click on a link? Whatever it might be, determine what that is and make it very apparent in your newsletter. The next thing is the subject line. That's kind of the cherry on top for your newsletter. This is what entices your patients to actually click on that newsletter when they see it in their email inbox. Now, with newsletters, one thing that we highly recommend is using some of the industry best practices regarding these, and this comes into play with A/B testing. Now, A/B testing, it's really simple. You're sending out, you may choose to send out one newsletter with a different subject line. So for example, you have a patient group A, you send them a newsletter with one subject line. You send patient group B the same exact newsletter, but with a slightly different subject line. And from there, you can monitor and see which one of those newsletters has a higher open rate by your patients. You can even change that up and change the content of the newsletters themselves. We have a link here for an article on how to view a report that shows you the open rate of your emails, your newsletters that are sent via email. But it's fantastic to be sending newsletters out, and it's really great if you have all of these different boxes ticked as far as the purpose, a call to action, a solid subject line. But what's really important is that you continue to improve and iterate on this process, because this will just continue to make it a better experience for your patients as they view these communications that you're sending out to them. And Justin,
Thanks
I think,
so much.
Yeah, go ahead.
Yeah, Addison, I'll take it back, and just before we move forward, I just want to, this is funny, but also not funny. Can I apologize in advance? My son is playing, we are, this is truly the remote environment COVID world. My son managed to talk his band director at school into letting him bring home a full-size marimba to our house. It is out in my garage, and I can hear him playing it right now. So if you don't know what a marimba is, that's worth a Google for a moment, and you can laugh at me and picture having to get a marimba back to my house in my garage. So apologies in advance. If I see him, I'll give him the death stare. As we go forward, we want to get into telehealth, and the setup with two-way texting and newsletters is having those as two ways to help you operationalize this again. And again, this is the third area that we got a lot of questions about last week, so we want to spend a little time here. And before I turn it over to Hillary, want to share some results of a survey we did with our customers over the last several days. And we asked, do you have where are you at today? Do you have a solution in place? And about 2/3 of you said we do, and many of you probably participated in this survey, so thank you for that. A third say they do not. And so if we're looking on the right side of the screen, a third of the respondents said they do not have a solution in place, but it's on the table. People say yes, they're planning to have it in the future, and 39% said we might. So it's at least something we're exploring. It's an option. For those who do have a solution in place, there were two survey results that really stood out to me, and I wanted to share them here. One is in response to the question, when did you start? Only 9% of our customers had started this before February of this year, which feels like a decade ago, right? But in the last 60 days, this has really ramped up, which tells me that we are all learning this and figuring this out together and seeing, is this a viable thing? Can we make this work? And it's going to influence that second question. Do we plan to continue use after COVID? Most people, whether it's short term or long term, there does seem to be either yes, we do totally plan to continue doing this, or we might. So I think right now is the time to get this figured out, not just because the current environment is forcing us to do this, but maybe this is a good time to test this and see, can we really make this a viable thing going forward? So with that setup, I wanted to bring Hillary Melander in and share some thoughts on telehealth and how we make this work.
Thank you, Justin, for that. You know what? I have to say, is this going to stick? Is this something that we're going to be pursuing? I just read a study recently where they were saying that telehealth with COVID, it's pushed us 10 years into the future. So we are moving towards an adoption that we wouldn't have seen it without COVID in the year 2030, right? So this is huge. This is really going to be something that in history, when we look back on how COVID really did help push innovation and adoption of these new technologies or current technologies that we haven't actually been taking advantage of. So why now? We've already talked about COVID and then 19 and how we have to flatten the curve. We have radical lifting of regulations, restrictions, and policies. Now, this isn't a webinar that's going to be walking through each of those. We do have blog posts. We do have other resources that will direct you to those if you are interested in learning more. But it is also a time where the expansion of payable CMS virtual care offerings has actually almost doubled in size as well. So really the opportunity is ripe. This is going to be staying with us moving forward. I just got a little doot-doot sound with my headset, so I'm going to be transitioning over in just a minute. But again, real world, I did look up marimbas, and now I'm going to be potentially playing with my Bluetooth as well. So thanks for your patience. So the point is, telehealth virtual services are here to stay, right? It is going to be a part of our lives moving forward, and it now is the time to figure out how. What is that blend? How are we going to be leveraging it as well? Now, it looks like we might be experiencing some technical delays as well, but that's okay. We're going to go ahead and keep talking here. Thank you, Justin. So as a disclaimer, policies are still evolving. As of Monday, there were still changes made to virtual visits and who can do those. So again, it's going to be important that we stay on top of the current situation. State laws vary, and regulation waivers and policies are likely to become more strict post-COVID, so let's keep that in mind as well. And payment from CMS and commercial health plans are still untested. I apologize for just kind of going through and reading some of these slides, but I do think they're important enough for actually making sure that we touch on these things. And the last thing here is that suggestions included in this webinar are based on our interpretations of recent regulatory and policy changes under the COVID pandemic climate. I do want to just make sure we put that out there because, again, this is the first time any of us has experienced anything like this, and we are all learning together. Now, instead of just telling you, make sure you do your research, we have given you a short checklist of some of the things that you're going to be wanting to stay on top of. And one of the, there's two things here that I'm going to touch on here. One is a link to a financial assistance available to practices, a blog post on that, and it's got a pretty extensive list of options available. And the second one that I'm going to highlight here is, you'll really want to consider your liability insurance and what the implications are for incorporating virtual telehealth into your practice. So again, the algorithms that they use and the analysis that they use to actually come up with liability insurance, I believe, is going to be evolving. It will be coming. Will it happen right now? No, but it is something that, maybe not, but it is something that you're going to want to look into. So putting that on the top of mind as well. All right. Now, the next thing that I just want to do is just pause for a moment. Just a reminder, I just want to remind you that you've got this, right? You've done hard things before. Many of you have set up your own clinics. Many of you have launched new services. And so it's just a matter of taking a moment to step back, breathe, and adopt that clinical mindset that you've already put to use and that you have. So again, just a shout out to remind you that you've got this, and you can have confidence in your ability to react and to respond. So, all right. Now, when it comes to your practice, you've been working and you've been running for many years, many of you, some of you have been new, but you've had your set of services that you've been able to offer face-to-face. But now, when it comes to a clinical mindset, I want you to think about this from what types of virtual services can you offer? How do you expand and go into your virtual practice? And that is what we're going to be getting at in the heart of this. Now, many people think of, when they hear telehealth, they just assume telehealth video visits. That's it. But there's more to that. There's a breadth of services that you can provide, from small, brief check-ins to that can fill in the gaps throughout the day, to telephone office visits, and even your telehealth video visits as well. So again, I want you to think about this as a spectrum of options that you can incorporate into your flow. And so as you're going through and prioritizing your flow, I want you to think about what can fit seamlessly into your flow that you can easily support. So think about that as we discuss these. So the first slide, so there are two types of virtual check-ins. Now, virtual check-ins are just for ongoing care. It can be for both new and existing patients. I'm not going to read through these slides. I promise. I know you may not believe me because I did read some of the other ones, but but I do want to just say that virtual check-ins, again, it can be through some kind of messaging, and we'll go on how to do that through SR conversations, and it can be through telephone. And what's great and ideal about virtual check-ins is that basically you've been doing this the whole time, but guess what? Now you actually get a bill for it. It's those situations where your patient either calls you on the phone and says, hey, can the doctor call me back? And they do, and they provide a consulting service. Or even now, which I think is even really exciting, is that you can use it through a text messaging platform. And so you can actually say, hey, a patient, again, you've notified them through newsletters, you've notified them through text messaging that these services are available. And then you can actually engage in a check-in through text, where they can send images of a rash, or they can explain symptoms, and the doctor can then respond between visits, or when they have a break, when they have a lull in the day. And so it's a great opportunity for filling in those gaps. Now, a couple of things, again, confirm your patient identity. There are qualifications around each of our services that you'll want to become familiar with, such as make sure it's not an issue that you can't bill for something that was discussed within the last 7 days, or that resulted in an appointment within the next 24 hours of the next available appointment. So you'll want to watch out for those caveats there. Now, the virtual check-in documentation, I've included a list here of things that you're going to want to document in this scenario. I do not go in depth on how to do this for all, because I think for every situation there are different types of information you're going to be getting, and you guys already you're familiar with those, some of the standard documentation practices as well. But when it comes to virtual appointments, especially virtual check-ins, you want to make sure you document patient consent. With many of the billable services, a lot of them are time-based, so you're going to want to document the total amount of time spent communicating with that patient during that time, right? So you're going to want to do that for both telephone. You're going to want to do that for asynchronous e-visits. That's going to be similar there. So again, that's going to become one of your standard practices. So think about how you're going to do that, and then also document again whether or not you can bill it if it falls within this qualifications around the previous days, whether or not the visit is based on a procedure that happened 7 days before or resulted in a service in the next 24 hours. So those are some of the things that you're going to want to document here. Now, here's some more information on e-visits. Again, different type. We're not even talking about telehealth video appointments yet. Like, this is different. This is a whole other type of service that you can offer right now. It's great for patients without broadband to support telehealth video. So this is, you want to think about, they still have some access and they still have the ability to send and transmit images, those types of things. And what's cool about this, I did just use the word cool in a webinar, my apologies for that, is that it's the only visit that can accumulate over time over a 7-day period. So that is actually interesting, and that because of that, you can actually bill for you can bill at a higher rate. It'll bring in a higher reimbursement than it does a virtual check-in, so it's different for that. Do you want to note that it's only billable for physicians at this point right now, and it may not be used for administrative stuff such as scheduling appointments or just sending test results, those types of things. So it has to be time spent with the actual provider. Again, similar to asynchronous for text messaging, it's something that can be done throughout the day within 24-hour period, over a 7-day period. So that's great as well. Telephone services, ideal for those patients who do not have that reliable Wi-Fi or internet services. So again, there are a variety of different codes that can go along with this. I do want to point out that with telephone services, there are different qualifications for that as well. For example, whether or not it's a patient with special needs so you're going to want to pay attention to those types of things here. Just shouting that out here. We do have a blog post with more in-depth information on that, and as well that goes more into the specific most common lease codes for each of these services as well. But telephone visit, office visit is going to be an option for you to offer as well. All right, now let's go to what most people think about when they think about telehealth video visits. Now, I think a lot of people will spend more time here because it does bring in a higher payment than a lot of the check-in services might provide as well. So yes, that is true. But again, the benefit of the check-in service is that if you can offer aid to just give peace of mind to your patients so they can talk through it and determine whether or not they really do need a visit, whether or not they really do need to come in. And during COVID, we're trying to keep people away, so you can triage whether or not a telehealth visit would be acceptable for them. Now, with a telehealth visit, it's great with these new regulations is that it is, actually across the board for all of these, is that it can be for both new and established patients. And patient geography restrictions have been lifted, so that's significant. I also think it's great that the number of practitioners are wider compared to all the other services. The other services are limiting for the most part for physicians or your provider that is able to engage in eminent and services here. I have my glass of water here. M&E services. And I do have, if you're not sure what consists of a Plan B provider, I've included a website where you can link into and it has more information there as well. The other significant change, again, just noting these to make sure we are all on the same page here, is that providers are able to provide telehealth services from their home. You do not have to be licensed in the same state as the patient, so that's great. And the other significant change is that the restrictions around the number of inpatient telehealth visits has been lifted. So before, I think there was a limitation between a 3-day period, so that's no longer an issue. So this is something that they can engage in, and it can become a normal part of quote unquote life, even after COVID as well. So a great opportunity for you. Now, there are a few things that you're going to want to think about. There are, you don't know what you don't know. But so here's some things that you'll want to prepare for. How do you handle disconnected calls? Yes, that's kind of a given. I think that's a top of a lot of people's minds as you're selecting providers and going through that experience. But what do you do about the situation where you have an appointment with a single individual, like a mom, and then all of a sudden it becomes a family ordeal? You've seen the 5-year-old, you've seen the 8-year-old, and you've seen the 12-year-old. How are you going to document for those? How are you going to chart for those? How are you going to bill for all of those? So it will be ideal for you to actually sit down and come up with these plans and the contingency plans, so you can respond quickly and appropriately as well. How will you handle the appointment? Again, this last point is important to emphasize as well, is because privacy is still important. Now, we have control over privacy when they're in your office. There's a low chance that somebody's going to walk into the room. So what are you going to do if another individual enters that room? How are you going to handle those types of things? So you're going to want to think those things through, and you're going to want to train on those as well, and so that you're prepared for that. Now, it's time to discuss the actual telehealth video visit, and you're going to want to make sure you have your lighting and your camera prepared in advance. Make sure that's all tested. Even I love it when different practices even initiate a test video health visit with their patients before they even launch in with the provider, making sure it's running as efficiently as possible. And that's going to be important for adoption later, and we'll talk about that later. As a reminder, turn off your cell phone, your apps, your notifications, and remember to encourage your patients to do the same. Now, the other point is, remember that just as an in-person, you're going to make sure that you do all that you can to facilitate clear communication. So take a moment, slow your speech. You're going to have people that come from different backgrounds, bilingual individuals. So you're going to want to make sure you take the time, slow down for that. And also, you don't want to rush the appointments, because now it's the time for you to connect. And connection is going to be important, because that is one of, I believe, the reasons that a lot of people have been resisting telehealth video visits in the first place. And so again, it's important to remind them that they have your full attention and not rushing the appointment. And one final note on rushing the appointment is that I've been talking with different colleagues who have actually started using telehealth themselves, and they've been amazed with how even that they've been covering the full depth of the appointment, and they've been taking their time, and they've been having positive experiences so far, and it's ending within 10, 15 minutes early. And so again, don't feel rushed. You're probably going to end earlier anyway, so you're going to be thinking about that for the future. And so again, just take your time. Make sure you look into the camera to help them feel, again, like they have eye contact. Many people are going to have multiple screens, your laptop, your desktop. Make sure that the camera is where you're looking at, and that's where you can take some notes also, so you can feel that they've got that connection there. And have your documentation processes set up in advance. Don't be fumbling around. Make sure you have that ready, and you know how you're going to be moving forward with that. So those are some helpful tips for videos. Now, there's a few things here that and I added as a checklist because they are important reminders for you. So first of all, a lot of people providers haven't, I don't believe this has been communicated as clearly, is that you do need to make sure that you enroll in CMS. So in the Center for Medicare and Medicaid Services does require provider enrollment. Now, this is going to be important for your physician's assistant as well, your nurse practitioner. Everybody needs to be enrolled. Luckily, they've come up with a pretty effective system so far of hotlines where you can do same-day approval as well. And I've heard that the waiting times haven't been bad at all. And so I provided a link here, and there's also other frequently asked questions around provider enrollment as well. Inform your patients. This is important, especially for the virtual visits and e-visits. They have to be patient initiated. That's going to be important here. Virtual services code. So a lot of resources I've been reading are saying use the code 02 for place of service. However, an update was made on, I believe it was the April 3rd update. I can go back. But the update was made where clarification around this was so that you are now able to use the place of service code 11, which would have been your office, and so that you can get the non-facility payment rate. So, so that was the March 30th change. And so this is important because the non-facility payment rate is 20 to 60% in most cases, like in many cases, higher than the facility rate. So this is why when they say office visits and telehealth visits are now able to get the same, you can get reimbursed for the same amount. That's only if you use that place of service code 11. So emphasizing that. Document everything. That's going to be important here. When you document everything, because again, this is untested waters, this is new, and you want to have all the information ready in the event that you need to challenge a denial of reimbursement. And then I did include a CMS full list, the link to find those services, and I believe we're at like 185 services, so almost 200. For more detailed information and specific codes and recommend most commonly used codes for each of those services, please link to that blog. You can click on the link to the blog post and you can read it in more depth around that as well. So now I've expanded on, given you a whole list of different services that you can incorporate into your practice. So let's pick a couple and kind of go through these new scenarios. So for example, the new patient journey with acute care, your patient wakes up, feels sick. They initiate a virtual check-in because you've communicated that to them through newsletters and through messaging and text messaging as well. Your office staff then confirms that they've got the consent to actually do these virtual check-ins, and they can actually assign the provider the check-in. Now in SR Conversations, our two-way texting platform, you can easily do that by using a flagging feature where you can actually assign that check-in to the provider. The provider can respond to that text conversation at their convenience, right? Again, and then they can determine whether or not they need to be called back in 3 days. And then if that's the case, then you can bill it as a virtual check-in. Or if they need to go on to a scheduled telehealth video, or if they need to move on to a face-to-face video. So that's a potential workflow that you can incorporate into your practice. Now, the other scenario is the urgent same-day scenario. So, for example, your child hits their head, and you're nervous, you're worried, like, what do I do? The parent calls the medical office. They're still kind of in a panic, and the office is able to confirm consent. They're able to contact the on-call provider, and then they can simply share a URL. Now, again, if you're using SR Conversations, you can facilitate a supported telehealth visit video by sending them the link to the URL. Then while you're still on the phone with them, then you can connect them both, the provider and the patient. They get onto the telehealth video call, and then the actual provider can walk them through the steps. They can calm the situation, and they can guide them through the process, and then determine the next steps from there. Again, what is ideal and great about the incorporation in a urgent same-day scenario is you really help get the right type of care at the right time to your patient. This is an ideal situation. All right, guys. I think you've taught for me, and I want to be able to bring in Addison. And Addison's going to be able to help talk us through some of the ways that we can support your telehealth visits, or excuse me, your video visits using Solution Reach.
Awesome. Thanks so much, Hillary. That was some really good information that I feel like I learn something new every time you go through it, actually. It's still just really, really intriguing to me. So what we're seeing right here, this is our pre-visit instruction feature. This is totally free in our platform. And we talked a little bit about this in last week's webinar series. So this type of message is sent out at the same time as appointment reminders. And the way that this functions is that your appointment reminder is sent out, but then you're also able to, you can think of this as kind of a bonus message, if you will. So how does it relate to telehealth? Well, in this case, you can add or adjust the wording of the message itself to include the telehealth link so that patients can receive their appointment reminder, but they can also receive this link to initiate the appointment itself, if that makes sense. And so along with adjusting your messaging to include any links that are applicable to the telehealth visits themselves, you also want to, again, let your patients know that this is a thing, that telehealth is a thing at your practice. Put it in your newsletters. You may even want to do outbound phone calls, potentially, as patients are getting ready to set up their appointments, like Hillary said, to help them troubleshoot things before the actual appointment begins. Let people know on inbound calls if they continue to call in your practice, and especially make use of that two-way texting to let them know. And I know we've said it a few different times throughout the webinar today, but there are links throughout these different slides that will allow you to, that you can click on, because we'll be sending this out as a PDF after the webinar is over. So we've got a link in there on how to create those instructions from scratch. But if you're already using those, you can definitely go in and adjust those messages as well. Now for the virtual check-ins themselves, you can make use of conversations like we already talked about. So again, with when it comes to consent, we want to make sure we're gaining consent in the necessary ways. In this case, you may want to gain consent verbally during the check-in process. You may want to gain it via SR conversations, which you can do with those templated messages that we talked about previously. You can also make use of these great little flag features. And the way this might work is if I'm a patient and I send a text message into my provider saying, hey, I think I need Dr. Jones to take a look at something really quick. The front office staff can gain the necessary consent. They can flag this. Maybe Dr. Jones takes care of anything that's flagged with the color green. And Dr. Jones can be logged into conversations as well and take care of those and respond to my text and help me out. So this is a great way to route those communications very effectively within the office space itself. And along with providing these services, I know Hillary talked about this, but you want to make sure that you're very explicit and communicating with the patient to confirm their requests to engage in a billable virtual check-in. We don't want to create any surprises for patients, so we want to make sure that we are, in this case, we really want to over communicate and check with them to make sure that this is what they want, this is what they are requesting from us as providers. And on this next slide, since we're talking about virtual, these telehealth and virtual health visits, this means patients may not be coming into the practice physically. However, we still need to be capturing updated information from them during the check-in process. So this means implementing a digital check-in process. Now, SR Intake is our tool for doing this and providing this service. You can send your intake packets directly to a patient's device, and it makes it extremely convenient for them to go through the check-in process from the comfort of their own home. As well as if you are continuing to provide services at this time, you can help them to use their cars even as sort of a digital waiting room. And as a patient arrives in your parking lot, you can send them the intake form if they didn't happen to fill it out prior to arriving. They can fill it out in the comfort of their car, and that way they aren't having to spend time in the waiting room, so that you can continue to conform with any social distancing practices that are being recommended. But along with saving the trees, which is fantastic, and saving some time, this is also, again, a great tool to use as you move forward, as your practice reopens or your clinic reopens. because you're removing the clipboard and all the, the jar of pens that we all, are very comfortable having at our front desk. You can get rid of all that because this takes the check-in process and puts it directly in the hands of your patients. So this can help help reduce the spread of any, diseases or germs that are going around the practice to help keep your patients and your staff healthy and safe.
Terrific. Thank you, Addison. And I'm just going to add a couple of other additional thoughts when it comes to telehealth and incorporating it into your workflow right here. What's great about the pre-visit instructions is that if you utilize that tool, you're essentially just using the same workflows that you've already established. It's the same appointment structure, or the same way that your patients currently schedule an appointment. And it's just a natural, smooth transition over to the telehealth side. So that's one way. And then the use of texting is just another way that you can actually provide that. Now, I know on the pre-visit instructions, you will want to use a URL that is static, that is designated specifically for your provider. And we do, if you're going to use that, we do recommend using a tool that has some kind of patient waiting rooms or something that for the doctor to actually, or the provider to actually accept another person to come in. It's essentially the same, it's comparable to opening the door and letting the patient walk into that room as well. So just another a note there. So now we've talked about the various different services that you can provide, and I do hope that you're able to identify 1, 2, or all 5 ways that you can implement that into your practice. And in fact, we are working on developing additional newsletters for you to even announce your virtual newsletters as well. I believe they're actually going to be available to you today, if not tomorrow. And so that's going to be a resource for you, because the goal is to not just survive, we want to thrive, right? So right now we're in survival mode. Eventually we're going to be in thriving, we're going to be growing, and we're going to be thriving. We did include a list of different resources that are available for financial assistance during this time. I encourage you to click on the link here on this page when you get that PDF, and to read a blog article that has a more extensive list and with the relevant links for you to review and as well. So that's going to be an option for you. This is also a great opportunity to set yourself apart, foster loyalty, because they do recognize and realize that not everyone is able to come back to full capacity. Elective care, vision, and medical, everybody's been hit in some way to different degrees. And now's a good time for you to continue to foster that loyalty. A couple of interesting ideas on this slide are that I want to point out is that if you have a high referring customer, have the provider reach out to them individually, right? Foster that relationship here. I'm not telling you to contact them every day, but I do think it's a good idea for you to reach out and let them know that you're there and you care and you're checking in with them. Update your auto response email template. I think this is probably the number one thing that most of us are guilty of, where you might just have an email that says, we're closed after COVID, we'll let you know when. You know what? Give them more information. What do they do in case of emergency? What constitutes an emergency? How can they reach you? What's the best way? Because if they're emailing you for a reason. They're trying to get in contact with you because they have a concern, they have something they need to discuss, and they need to know that you're there during this time. Update your website and your voicemail, especially if you're going to be offering these types of services as well. Send those newsletters. Now, one other idea is the last one here on the list is if you aren't able to offer in-person services right now, it's in your favor to actually set up a referral program to actually refer them to someone that you trust. And the reason is if you just leave them to their own and make sure that and they have to find their own provider during this time, chances are they may not come back to you. But if you insert yourself into the process, they are actually going to think of you as if you helped them in that during this emergency, and they're going to be likely to come back. Now, the last thing that I'm going to touch on here is that technology is only 10% of the situation, or excuse me, the solution when it comes to actually incorporating your virtual services and with telehealth. You're going to want to focus on change management and your workflows. If you can focus on those two, you're going to have a better long-term adoption, because then you're going to be ensuring that everybody has a seamless, smooth experience for both your provider and your patient. And so thank you so much for this opportunity to be able to share this information with you all today. Handing it over to you, Justin.
Yeah, thanks, Hillary. And I've tried to go ahead and launch a poll question. Some of you guys who were here last week have probably already answered this, and hopefully you've gotten those materials in your hands. But wanted to share, we've got, along with the slides and the recordings of all the great information Hillary and Addison shared, we've also got a few other options for you. One is we can make sure you get a copy of our Practice Comeback Playbook. It's about a 30-page document that walks through a lot of this stuff. We can make sure you've got these printable checklists that go, steps back up to the broader Practice Comeback plan we put together and walk through all three phases. Again, today with this focus on telehealth and two-way texting and newsletters. This is that phase 1 urgent area, but we've got other checklists as well. And then if you're interested in getting information on a personalized comeback plan for your practice, let us know, and that would include us walking through that with you and having somewhat of a comeback coach to help you make the tweaks you need to make and adjustments and really get you ready to, like Hillary said, not just survive but thrive here. So please let us know which of those you would like, and I'll close that poll now. But you're welcome to drop something in the Q&A if you weren't able to answer. Again, real quickly, wanted to plug upcoming deep dive sessions. Next week we're talking recovery phase 2. The week after we're talking about growth. And again, if you didn't catch the email address at the beginning of the webinar, wanted to remind you, if you're a Solution Reach customer, you can email us at community@solutionreach.com and get answers to your questions. And if you're not a Solution Reach customer, and I've seen a couple of people mention this in the Q&A, feel free to go ahead and send us an email if you're interested in learning more. Send us an email to our sales@solutionreach email address, and we'll be happy to get you in touch with the right person. Or you can call us at 800-995-8444. Again, thank you so much for being here, for the time today, and allowing us to share what we've put together. Hopefully you found value. Really appreciate everything you're doing to take care of our families and our friends and our communities right now. Big thank you to Hillary and Addison for spending time with us and sharing as well. And we'll hope to see you right back here next week. Thanks, and have a great evening.